Section 5. Birth and the Postpartum Period. There are three main stages of birth. First is uterine contractions. These start about 15 to 20 minutes apart, lasting up to a minute each. Gradually, the contractions get closer together, last longer, and get stronger. This is causing the cervix to stretch and open. By the end of the first stage, the cervix opens to about 10 centimeters. For a first child, this first stage lasts an average of 6 to 12 hours. In the second stage, the baby begins to move through the cervix and the birth canal. Contractions come almost every minute. The mother bears down to push the baby out. This stage lasts about 45 minutes to an hour. The third stage is the afterbirth. In this stage, the placenta, umbilical cord, and other membranes are detached and expelled. This only takes a few minutes. The vast majority of births in the United States take place in hospitals, with fathers or birth coaches providing assistance in addition to doctors and nurses, although home births and births in freestanding birth centers are becoming somewhat more common. In these situations, the birth is most likely attended by a midwife, trained health practitioners who help women during labor, delivery, and afterbirth. Sometimes a doula also attends the birth. These are caregivers who provide continuous physical, emotional, and educational support for the mother before, during, and after childbirth. They're not delivering the baby. They are there for support. As much as I love my husband and he loves me, he was pretty much a deer in headlights during the birth of our first child. So it was nice that I had a doula who knew what to ask and what to do to help keep me comfortable. There are pros and cons when it comes to choosing methods of childbirth. When having a vaginal delivery, there are a number of analgesics and anesthetics that may be used to reduce pain. Sometimes these drugs may slow down the labor process too much, leading to the use of oxytocin or pitocin to increase the strength of contractions. It's hard to predict how each individual's body will respond to these drugs, so it's important for the mother to assess her level of pain and have a voice in the decision as to whether or not she should receive medication. Some women opt for a natural childbirth, meaning no drugs are given to relieve pain or assist in the birth process. Instead, they spend weeks or months before labor practicing relaxation techniques and controlled breathing techniques, and learning about anatomy and physiology in order to reduce stress or anxiety. Other non-medicated techniques to reduce pain include water birth, in which the mother gives birth in warm water, massage, and acupuncture. Sometimes a cesarean delivery or C-section is either required or opted for. With a cesarean, the baby is removed through an incision in the mother's abdomen. It is a helpful thing to be able to do if the baby is in the breech position and can't easily be born vaginally, but it is criticized as being overused in the United States, where 1 in 3 women give birth by cesarean. It is a major abdominal surgery that has implications for the mother's recovery period and future births, so the benefits and risks continue to be debated. Birth involves considerable stress for the baby. If delivery takes too long, the baby can develop anoxia, a condition in which the newborn receives insufficient oxygen. Fortunately, the baby has considerable capacity to withstand the stress. After birth, a newborn is weighed and tested using the Apgar scale within the first few minutes. A newborn's score on the Apgar scale indicates whether the baby has urgent medical problems. They can receive a score of 0, 1, or 2 on each of the 5 areas, giving them a total score from 0 to 10. Heart rate, respiratory effort, muscle tone, body color, and reflex irritability are evaluated. A total score of 7 or above is good. A total score of 5 indicates there may be developmental difficulties. A score of 3 or below signals an emergency and warns that the baby might not survive. There are 3 related conditions that pose a threat to many newborns: low birth weight, preterm birth, and being small for date. Any infant born below 5.5 pounds is considered low birth weight. Sometimes babies are born low birth weight because they were born preterm, or in other words, they were born 3 weeks or more before full term. Or their weight may be below normal for the length of the pregnancy. For example, they may be born full term but weigh only 5 pounds instead of the average 7 or 8. Or they may be preterm but are even smaller than one would expect for a preterm infant at that stage of development. Most preterm and low birth weight infants are healthy, but the number and severity of problems they experience increase when they are born very early and as their birth weight decreases. Low birth weight has been associated with increased risk of learning disabilities, ADHD, autism, or breathing problems such as asthma. A common intervention used in the neonatal intensive care unit, or NICU, is Kangaroo Care. This is skin-to-skin contact in which the baby, wearing only a diaper, is held upright against the parent's bare chest. For some reason, close physical contact can help stabilize the heartbeat, temperature, and breathing. A special component of the parent-infant relationship is bonding, the formation of a close connection, especially a physical bond, between parents and their newborn infant. Some physicians believe that there is a critical period shortly after birth when the parents and newborn need to form an emotional attachment as a foundation for optimal development. There is some support for this, but not so much that you need to be worried about it. Basically, there is enough support for it to recommend that mothers should not be kept from interacting with their newborns if they want to remain with them. In fact, many hospitals are now offering a rooming-in arrangement where the baby stays in the mother's room most of the time instead of in a hospital's nursery. However, if parents choose not to use the rooming-in arrangement, the weight of the research suggests that this decision will not harm the infant emotionally, so do whatever feels right for you. The weeks after childbirth present challenges for new parents. A woman's body is making lots of physical adjustments, and emotionally she may feel a wide range of feelings: excitement, exhaustion, worry, disappointment if the birth didn't go as anticipated. These are all normal feelings, but the roller coaster ride can make some women feel concerned that maybe something is wrong with them. About 70% of new mothers experience postpartum blues, feelings of anxiety, upset, or depression that can come and go following birth. Usually these feelings peak a few days after birth and then decrease after a few weeks. However, sometimes the feelings don't go away. Sometimes women, about 1 in 10, develop postpartum depression, which involves a major depressive episode that typically occurs about 4 weeks after delivery. Strong feelings of sadness, anxiety, and despair, and trouble coping with daily tasks, which may worsen without treatment. This is problematic because it affects the mother's interaction with her infant. It is very important that women see their doctor about this so that they can receive the medication and social support that they need. Some professionals refer to the postpartum period as the 4th trimester. Although the time span of the postpartum period does not necessarily cover 3 months, the term 4th trimester suggests continuity and the importance of the first several months after birth for the mother. Note the difference between the postpartum blues and the postpartum depression. Symptoms of postpartum blues appear 2 to 3 days after delivery and usually subside within 1 to 2 weeks. Symptoms of postpartum depression linger for weeks or months and interfere with daily functioning. So to review, we discussed the evolutionary perspective on lifespan development. We described what genes are and how they influence human development. We explained some of the ways that heredity and environment interact to produce individual differences in development. We characterized the course of prenatal development and its hazards, and we summarized how birth takes place and described the nature of the postpartum period.